Hey guys, Dr. Will here from Miami Spine and Performance. Thank you for watching the last video. We are in part 2 of our series where I'm going to show you guys a typical treatment approach with the patient. We have Liam here. If you didn't watch the last video, she's dealing with some suboccipital headaches and some TMJ issues, predominantly because she travels a lot for work. So today what I'm going to show you is my soft tissue approach and decompression approach for the upper neck and for the jaw. So can I have you slide up a little bit for me, please? Okay. So oftentimes it's these muscles through here that get tight, right? These suboccipital muscles. These are the ones that are causing people headaches, causing people neck pain and jaw pain. So I'm just going to release some of these to start, and we're just going to stretch them out. So I'm just kind of pulling on the muscle, creating a little bit of length and creating some extra blood flow through that area. It's very gentle. It's not about creating pain or anything like that. It's just about stretching through the muscles. So this is the area that gets jammed up when our chin goes forward, so we're just opening it up so that we can get back to a nice neutral spine position, just like so. Some of these muscles also do rotation, so we're going to stretch into rotation, just like this. And again, you can get a tremendous amount of relief from tension headaches and jaw pain and neck pain without the use of the adjustment if that's something you're not comfortable with. That's totally fine. That's why we offer a variety of different treatment modalities here. But you can get a lot of relief just by doing some soft tissue work. So there's 4 primary muscles in this area. We're going to touch on all of them. And again, the idea behind what I'm doing here is I'm putting pressure through the muscle, and then I'm moving the patient so that I can stretch the muscle. All right, so it's a 2-for-1. It's like you're getting a stretch and massage at the same time. I'm going to do both sides, so I'm going to come on the left side, same thing, big stretch and big move. Just like so. You doing okay, Liam?
It feels so good.
There you have it, guys. I promise I'm not paying her to say that. It's authentic.
Mostly the left side.
And sometimes as you rotate and stretch the muscle, you'll feel some sticky spots getting exposed, right? So I feel as I rotate, some of these sore spots kind of come out. I'm just applying a little bit of pressure, relieving some of that tension through there. And I'll go the other way, this one as well. Sometimes when you rotate this way, those angry muscles in the neck pop out. You can finally get in and get to them. So this is a very hard thing to do on your own. And not every therapist, chiropractor is going to be trained in this kind of thing. So we're very specific muscle by muscle. Feeling that soreness in there?
Yeah.
Hurts so good? Okay, so now we've kind of worked through the suboccipitals. We'll do something a little more. Just kind of work through here, make sure all the tissue's nice and loosened up. Now we've done our adjustment, we've loosened up the muscles. You can also do a little bit of a stretch through here. Go ahead and tuck your chin down for me. So we kind of stretch through that area. And again, since all of us generally have kind of that forward head, forward chin posture, this stretch is helping us open up the back of the neck and bring some blood flow and oxygen back to that muscles. Those muscles tend to lose oxygen, lose blood flow because we're pinching them and we're pinching on the vessels. This is it. Once we get that blood flow back, your neck's going to feel fantastic. Your headache's going to be gone. Your brain fog is going to decrease. If you sleep well and hydrate, of course. So then we'll check the upper traps. Usually, people who travel on airplanes have angry upper traps. So typically we're going to find some trigger points in here. And patients often ask me, what is that? Why do we get those trigger points? And in my experience, usually it has something to do with the way that you're sleeping more than the way that you're sitting. If you fall asleep on an airplane, your head's resting on the window, you have one of those little C-shaped pillows, the upper trap's going to get kind of yanked on and it's going to get a little bit angry. So let's kind of get in here and just some TLC, tender love and care. Again, I'm a big fan of kind of stretching at the same time as I'm doing this. It just kind of enhances that effect of the tissue. We'll see how the left side is behaving. Same thing, very tight through here. Doing okay?
Yeah.
And look, guys, I'm sure if most of you came in here and I started working on it, you'd probably feel the same thing. I know a lot of us are carrying a lot of stress in our traps and in our suboccipitals. I know I am, so this is why I get this kind of treatment done myself as well. Take a couple deep breaths. I'm just keeping pressure on this trigger point here. Same thing, we'll just apply some kind of general pressure to the area. Drop the shoulders a little bit, get everything to kind of loosen up and relax. Now, last but not least, we're going to address the TMJ, right? So the temporomandibular joint, right? So that's the jaw. A lot of times this neck tension and TMJ pain goes together, right? People don't necessarily know that the cervical spine and the jaw are so intimately connected, but if you think about it, it's right there, right? The jaw is here, the neck's here, right? So they kind of come to the same point under the ear. So it's important that if we're addressing a neck-based headache or a jaw-based headache, that we're treating the other, right? Because we want to kind of treat everything that could be contributing to the issue, right? There's other things such as grinding your teeth and things like that that can contribute to it, but oftentimes it's the neck that's driving the jaw pain. So in the jaw, we're going to be working some of these muscles up through here, and we're going to work these muscles here, and then some muscles down here, okay? So what I'm going to have Liam do is, once I put the pressure through here, I'm going to have you slowly open your mouth for me. I'm just going to follow the tension. Good. Go ahead and close. And begin. Open. Close. One more time. Open. Close. Now we're going to work this muscle here, the masseter. So I'm just going to apply a little bit of gentle tension. I'm going to have you open one more time for me. I'm just going to follow the tissue down. Okay. And again. Follow the tissue down. We're just trying to open up all the muscles that attach to the jaw, take all the tension off here, so she should be able to open all the way and not have any deviation side to side. Last but not least, I'm going to have you push your jaw up to the ceiling for me. We're going to sneak underneath and work this muscle through here. Good. And again, push up to the ceiling. And this is a muscle that rarely gets worked, rarely gets touched, because you kind of have to move the jaw to even get to it. But it can be a big contributor to this jaw pain. This is the digastric for those of anatomy nerds out there. Good. Two more. Last one. And rest. Okay, the last thing that we're going to do is we're going to use the Y strap to get some manual decompression and make sure that everything's loosened up so she can go about her day and with no tension. That's the plan, at least. So I know you guys love this thing. You love the Y strap. You love watching these Y strap videos. We're not doing the ring dinger today, but we're going to use the Y strap to get some nice decompression. You can use these things in a very gentle and effective way without doing anything violent or aggressive. Okay. So, as you can see, Liam is not lacking in the hair department. So we're going to try to get all the hair in here. There we go. Put this under her head. Put this chin strap on. Drop Take a little bit. So again, guys, the purpose of this is to get some decompression, right? We're all day, gravity's pushing down on our head, right? Or our head's forward, we have our musculature compressing our neck. So sometimes just to get a little bit of decompression can be extremely relieving. Okay. Here. Readjust this. So we're just kind of tractioning the skull away from the spine very gently. Just to get some decompression in the neck. And honestly, if you can get some decompression in your spine every day, then you should, right? Because we're spending so much time under compression. You can spend even 1 minute decompressing your neck or decompressing your low back. It can add years to the life of your spine. Good, right?
Yeah.
All right, guys. So those are some other options that I use here in the office to either complement the chiropractic adjustment, or I do have patients, God bless them, they're nervous about the neck adjustment, and that's totally fine as well, right? I don't have any issues with that. So we have a number of other tools that we can use as well, right? Chiropractor's not just all about cracking bones and adjusting, right? We have a lot of other tools we can use, so utilize us if we're in your community. In the next video, we're going to take a look at Liam's hips, because she has some very interesting things going on, and I'm going to talk you guys through my thought process a little bit of what maybe differentiates the way that I look at these conditions versus maybe other providers or and things like that, okay? So thank you guys for watching. Part 3 will be coming next week. Don't forget to like, comment, and subscribe. Dr. Adams from Miami Spine and Performance.